Subcommittee will come to order. The Chair will recognize himself for an opening statement. On August 1st, CMS Administrator Marilyn Tavenner testified before the full committee on implementation of the Affordable Care Act, and she assured us that despite numerous delays, including a one-year delay of the employee choice provision of the shop exchanges, the employer mandate, the verification of eligibility for insurance subsidies, that the exchanges would be ready on October 1st to begin enrolling Americans in new health plans, and that implementation of the law's other provisions was on track. Since that hearing, we've learned of several troubling developments. On August 13, New York Times reported that it had discovered a delay in the implementation of the law's out-of-pocket caps buried in a list of 137 frequently asked questions posted on the Department of Labor's website on February 20, 2013. On August 27th, CMS announced that instead of finalizing contracts with health plans set to participate in exchanges between September 5 and September 9, as had been expected, final contracts would not be signed until mid-September. The Affordable Care Act's implementation involves a litany of federal and state agencies, and my constituents are understandably confused about what is happening with the exchanges, enrollment, and premiums. Considering the administration's track record on deadlines and delays, reassurances from CMS officials are not comforting. In our previous hearing, Administrator Tavenner also made an extraordinary remark that she had only heard of, quote, isolated incidents, end quote, of the ACA having burdensome or negative impact on Americans. I would briefly like to share the experiences of some of my constituents who are being harmed by the law. In April of this year, Eastern Lancaster County School District and Penn Manor School District in Lancaster, Pennsylvania, both announced that they were outsourcing some employees to avoid cost of complying with the ACA's employer mandate. Elanco will outsource approximately 90 food service workers and classroom aides, and Penn Manor is shifting more than 95 special education classroom aides off its payroll. The affected employees work over 30 hours a week, thus triggering the employer mandate, and the school district simply cannot afford to pay for the additional expenses of covering these individuals. Dairy farmers in my district, members of the Mount Joy's Farmer Cooperative Association, which is affiliated with Dairy Lee Cooperative, currently enjoy a negotiated plan characterized by a low-risk pool and shared savings. As of January 1st, 2014, they will lose this unique risk pool and be forced on to the exchanges. A father from my district wrote me distraught about his daughter's work hours being cut to 28 hours a week because her employer could not absorb the cost of providing her with health insurance. He is among dozens of people who have told me that their hours have been cut and they have been moved from full-time to part-time as a direct result of the ACA. Dozens more have expressed concern and shock at the staggering premium increases that they face in 2014. These are not isolated incidents. So with that, I'd like to welcome all of our witnesses here today, and I look forward to their testimony, and I yield the balance of my time to the gentleman from Georgia, Dr. Gingrey.
Thank you, Mr. Chairman. We are now 3 weeks from the beginning of open enrollment for Obamacare exchanges. It is fitting that we have before us today the vendors who are charged with running the exchanges. While I'm sure that these companies are working as best they can to meet the deadlines, the reality is that most were awarded contracts within the past few months, and the complex system has yet to be fully tested. How can taxpayers expect to feel secure with their personal information in the exchange when they have not been had adequate security checks to determine its effectiveness? Mr. Chairman, Obamacare will saddle taxpayers with higher premiums, fewer choices, and the potential for employment disruption. We must work to ensure that our citizens will not face fraud and identity theft from the law as well. And with that, I yield back, and I thank you for the time.
Chair, thanks, gentlemen. At this time, I'd like to request unanimous consent for Representative DeGette to participate in the subcommittee hearing. Without objection, so ordered. And the chair recognizes the ranking member, Mr. Plone, for 5 minutes opening statement.
Thank you, Chairman Pitts, and a special thanks to our witnesses for taking the time to be here today. I know you're right in the middle of gearing up for the October 1st start of open enrollment for the healthcare exchanges, and that your time is valuable. I must say that I'm extremely troubled by the Republicans' repeated tactics to try to slow the progress of all of those individuals and organizations working so hard to implement the Affordable Care Act. In particular, the oversight letter that committee Republicans sent to 51 groups, primarily community organizations that received grants to serve as navigators to help the uninsured sign up for benefits under the ACA, I think is despicable. This is an egregious abuse of the committee process and an attempt by Republicans to intimidate community organizations and overwhelm them with information requests at a critical period so that they don't implement the program. I've been working with organizations in my district, such as the Food Bank of Monmouth and Ocean counties, who have taken on the responsibility of being navigators for the community to make sure that they know their rights under the committee rules. But even more so, I'm encouraging them to remain committed to the critical work they are doing and not be detracted from their laudable goals of helping uninsured people gain coverage. It's time that the Republicans stop trying to obstruct the law. Healthcare reform is undeniably moving forward. It's hypocritical that Republicans are holding this hearing today to say that the health exchanges are not ready and that the administration doesn't have enough staff or resources when the Republicans are the ones who refuse to adequately fund the law and are out advocating for it to be defunded. But despite this, I think what we will hear today from our witnesses is that the contractors, community organizations, and states are ready for October 1st. It's going to be a challenge, that's for sure. Will the rollout be flawless? No. Will there likely be some hiccups along the way? As with any major program rollout, yes. But these groups have been working day and night to make sure that they're ready for enrollment so that Americans can start receiving the benefits of health insurance. And starting October 1st, millions of people will gain access to health care coverage they didn't have before. Individuals in every state will have access to a health exchange where they can select coverage from an array of qualified health plans. Every health plan will offer essential health benefits, including preventative services such as screenings and vaccines, mental health services, trips to the emergency room, outpatient care, care before and after your baby is born, prescription drugs, lab tests, and pediatric services, including dental care and vision care for kids. Now, one area where more progress is needed is state expansion of Medicaid. An important tool included in the ACA was the strengthening of Medicaid by allowing states to expand coverage to individuals and families who did not previously qualify for the program, but also did not have the resources to access affordable quality care through the private insurance market. Not only is this beneficial for low-income Americans, it's an advantageous fiscal arrangement for states. And I'm disappointed that a number of states still have not chosen to expand Medicaid coverage, and anticipate we'll hear from Ms. Krause from the Pennsylvania Health Access Network today about how the continued refusal of states to accept federal funding and expand Medicaid will hurt low-income families as well as state economies. So implementing the ACA is a huge undertaking. It involves the coordination of a number of complicated provisions. We can't expect everything to go perfectly, but we can support the administration, the contractors, the community partners, and the states in their efforts so that the American people can access health care as intended on October 1st and receive the assistance they need to sign up for health insurance. I just hope that my Republican colleagues will realize this and stop trying to impede the law and those working to implement it. I yield back, Mr. Chairman.
Chair, thanks, gentlemen. Now recognizes the Vice Chair of the Subcommittee, Dr. Burgess, 5 minutes for opening statement.
I thank the chairman for yielding. And let me just say in reply to my friend from New Jersey that it is the oversight function of this committee and its subcommittees that really has been one of the cherished functions in the Congress of the United States. And certainly under both Democratic and Republican committee leaderships, the oversight function is one that other members of the Congress look to. They look to the oversight function of this committee. So now we are in a new situation where self-attestation is going to be the watchword for people who show up and sign up for benefits. Why wouldn't we have questions about the vast sums of money that have been pushed out the door relatively hastily to these navigator groups? Why wouldn't we have questions as to their credentials, as to their ability to provide what they've been required to provide. And why wouldn't we have questions that other members of Congress would like answered as well? So really it is a function of this committee to provide that oversight function. And I, for one, Mr. Chairman, am grateful that those letters did go out, and certainly in support of the fact that we are trying to simply get the information that the administration, for whatever reason, does not want to give to the Congress.
Would the
So
gentleman
here,
yield?
no, I will not. I've got some things to say. If I have time at the end, you may be welcome to it. We have 3 weeks, 3 short weeks, 21 days, ready or not. October 1st, the health exchanges, including the federally facilitated marketplaces run by the Obama administration, will open. While the White House, Treasury, and Health and Human Services continue to report that everything will be ready, everything is fine, we've only seen missed deadlines, delays, and really an overall lack of information. And the most significant function for the operation of the exchanges, as it turns out, is not in the hands of the administration, but has been outsourced. It's been contracted to organizations, and many of those witnesses are before us today, and we appreciate your participation. The federal hub will be the center place of the exchanges, coordinating data from over 5 federal agencies, millions of individuals, hundreds of insurance carriers, and in all 50 states. Not surprisingly, the complexity involved in coordinating the exchange has led several states, notably Oregon and California, to indicate that they will likely need to delay access to their online marketplaces. States have begun making contingency plans, but the administration continues the same refrain: we will be ready. Instead of communicating with Congress, the administration has decided just to open the door to eligibility errors and fraud and inappropriate payments by removing verification requirements and allowing consumers to simply use self-attestation. Because the agency is silent, because Health and Human Services will not speak on this, we must go to the source, the contractors who have to live in a world. Your world is comprised of contingencies and possibilities, deadlines, and an ever-shifting environment. You know you deal with contingencies all the time. The President's healthcare law continues to create more chaos, more uncertainty for Americans. Since the administration won't admit the enormity and complexity of the task they have undertaken, we have our witnesses today, and I hope that we will hear from them, from these people who are actually preparing the systems, will be able to tell us the real status of the implementation of the Affordable Care Act. And let me then yield to the chairman of the Oversight Subcommittee, Mr. Murphy.
Thank you very much, Doctor. It's kind of preposterous things the gentleman from New Jersey says, as if the Oversight and Investigation Committee has no business having oversight and investigation. When we have multiple hearings, we heard that from people from the administration that everything was fine for business rollout, only to say, well, it wasn't ready, and they had to slip in a little unknown statement to say we're going to delay it for a year. They said the exchanges actually were supposed to start their training August 1. They didn't even start hiring until lately. They also, we saw the administration had to waive some of the rules for caps on co-payments and deductible. Labor has to take out full-page expensive ads to get the attention of CMS, who wasn't talking to them. Treasury came before us and said they haven't heard any concerns from individuals. And by law and by design, the way the bill was written, the navigators have to be people who are inexperienced with selling insurance, by law. So we have every right to ask questions on behalf of the American people. That's what oversight is supposed to do. Quite frankly, I'm puzzled by people who are trying to say that we're trying to delay this. No, I think the delays have been there because the administration, even though they've had a few years to do this, simply is not ready to bring this forward upon the American people. So we will, and we will continue to ask questions about how this program is going. If everything's fine, people have nothing to be afraid of. But quite frankly, I think we have a lot to be afraid of, and that's why things aren't fine. Thank you.
Chair thanks the gentleman, and now recognize the ranking member of the full committee, Mr. Waxman, 5 minutes for opening statement.
Thank you, Mr. Chairman. This is an interesting example today of the Republicans ignoring their own oversight findings. They started this investigation in August. They did interviews. They got documents. They learned that the contractors were doing everything right, and they were on target to meet the deadlines. Rather than talk about that, they're attacking the law, which they've attacked from the very beginning. They want to portray health reform as impossibly complex, inevitably doomed enterprise, and that's what we're hearing again today. We have 4 private sector contractors who are actually in the trenches with the administration implementing this law. Today's witnesses are not political. They will tell us that the administration is making steady, step-by-step progress. Their testimony will deflate the overheated Republican rhetoric of a coming health care apocalypse. Last month, the committee launched an extensive investigation into these contractors. They peppered them with these questions. They scoured the documents for signs of impropriety. What they found can be summarized in one word: nothing. The facts don't measure up to their doom and gloom talk. That's why they've said virtually nothing about their own investigation. To fill this void, the Democratic staff is releasing a supplemental memo outlining what we learned from the Oversight investigation. The key findings are as follows. 1, the contractors and CMS have numerous systems in place to secure the privacy of consumer information. 2, the contractors are on track to complete their remaining tasks by October 1. 3, CMS management of the program is sound. And 4, these contractors are creating thousands of jobs throughout the country. In my view, the timing of the committee's investigation is under suspicion. Burdensome demands came during the most critical phase of these contractors' work. The committee is taking the same approach as in its investigation of the healthcare navigators. But having launched the investigation and received extensive responses, we should not ignore what we've learned. That's why I ask unanimous consent that this memorandum that I've referred to be made part of the record.
Without objection, so ordered.
I want to make just a couple points before I yield. Inevitably, there will be some glitches and hiccups in implementation of this law, and I expect every time they find any hiccup, the Republicans here in Washington will make a hue and cry about it. I believe we should keep our eyes on the bigger picture. Problems that arise will be fixed. We're on a steady path to offering every American quality, affordable health coverage and making our healthcare system more sensible, efficient, and fair. It's also important to remember that most of the implementation problems are likely to come from Republican state leaders who are openly obstructing our goals of the law. Antoinette Krause of Pennsylvania Health Action has firsthand knowledge of what this senseless intransigence means to the hardworking Americans caught in the middle. I now want to yield 2 minutes to my colleague and friend, Mr. Butterfield.
Thank you very much, Mr. Waxman, for yielding time. Mr. Waxman, I want to associate myself completely with your statement and that of Mr. Pallone. Mr. Chairman, I am absolutely outraged that the chairman of the full committee and subcommittees on health and oversight, as well as other Republican members of this committee, sent a 3-page investigatory letter to 51 grant recipients demanding that they answer questions, giving them only 2 weeks to provide detailed descriptions of the anticipated scope of work, among other very specific questions, to provide all documentation and communications related to their grant. My question to my staff and to you, my friends, how can 15 members of this committee simply get together and send a letter without committee action? Wasn't the vast majority of the information being sought by Chairman Upton and Pitts and Murphy included in the Navigator's application to CMS? These grant recipients only received word they were selected to receive the grant on August 15th. Might I remind my colleagues that the marketplace goes live on October 1st, less than 1 month away. The majority is forcing these recipients away from their important work of getting ready on October 1st and diverting their limited resources to entertain its fishing expedition. Yes, that's what I'm calling it, a fishing expedition that will surely come back empty-handed. There is no evidence of any kind that any Navigator grantees have misappropriated or misused grant funds in any way whatsoever. This is a gross misuse of the committee's investigative authority and just another way this majority is attempting to derail the Affordable Care Act. I am outraged by your actions. I want you to tell me when these letters come back what you have discovered. I believe you will come back empty-handed. Thank you. I yield back to Mr. Waxman.
Chair thanks the gentleman.
Mr. Chairman,
That concludes the...
May I ask unanimous consent to include in the record a copy of Mr. Waxman's letter dated August 30th, I guess it is. Yes.
Pardon me just a minute. Do we have that?
Yes. Mr. Waxman's letter to Mr. Upton dated August 30th. May I include this in the record?
Without objection, so ordered.
Thank you, Mr. Chairman.
All right, we have one panel, 7 witnesses today. First, we have Mr. Brett Graham, Partner and Director of Exchange Programs, Levitt Partners. We have Ms. Antoinette Kraus, Director of Pennsylvania Health Access Network. Mr. Edward Lentz, Senior Counsel, American Staffing Association, testifying on behalf of the Employers for Flexibility and Healthcare Coalition. Ms. Cheryl Campbell, Senior Vice President of CGI Federal. Mr. John Lau, Program Director of CERCO. Ms. Lynn Spellacy, Corporate Counsel, Equifax Workforce Solutions. And Mr. Michael Finkel, Executive Vice President of Program Delivery, QSSI. Thank you for coming today. You have 5 minutes to summarize your testimony. Your written testimony will be placed in the record. And at this point, I'll recognize Mr. Graham for 5 minutes for his summary.
Good morning, Chairman.
Make sure the red light's on.
Push the button. Good morning, Chairman, Pitts, members of the subcommittee. Thank you for the opportunity to testify today about the ACA as well as state readiness around state health insurance exchanges. I am the Managing Director of Levitt Partners Center for Healthcare Intelligence around health insurance exchanges. We advise clients on the health insurance exchange landscape. Several of my colleagues have been very involved in both the design and development of insurance exchanges, both in the private sector as well as publicly. Levitt Partners has also been very involved in advising clients on implementation and being ready for that implementation. First, let me say that it has been very impressive, all the work that states have done to be ready for the open enrollment season, which is just 3 weeks away. What they have done has been impressive. That being said, today where we stand, there is not a single state that is completely ready for open enrollment 3 weeks away. In an ideal world, states would be well into their outreach and education campaigns with all of the exchange operations and functionality fully tested and completed. In the current situation, however, uncertainty and doubt still surrounds on how functional these systems will be on October 1st. The bottom line is that while Levitt Partners believes that a very baseline functionality of state-based exchanges will be up and running on October 1st, it can be expected that most, if not all, exchanges will experience a rocky enrollment period as they work to overcome both known and unanticipated challenges that arise. Today, I would like to focus on 4 critical challenges that states are facing as they work towards implementation in the short term. The first challenge states are facing is the complexity of an exchange's architecture itself. The establishment of these health insurance exchanges is one of the most aggressive and complex IT projects the federal government has ever undertaken. Certainly it is in the healthcare space. Coupling the complexity of these challenges with the informational delays has clearly strained states' capacity to complete their exchanges both on time and as originally scoped. In fact, as states are making final preparations for open enrollment, many have had to de-scope the capabilities they planned in order to be up and running on October 1st. While this is the right thing to do from a management perspective, it will certainly have an impact on consumers as they go to the exchanges. The second challenge that is facing states is data verification and integration with the Federal Data Services Hub. Our surveillance of the exchange landscape shows that while some states have completed testing, others are working through the final testing phases despite still being in the building stage of development. This is problematic. Several states have expressed to us concern about using the Federal Data Services Hub and where possible are planning to use their own data resources for verification. The third challenge is privacy and security. In addition to integration challenges, there are also serious concerns regarding the security of the Hub's data. The Office of the Inspector General recently stated that any additional delays in completing the security authorization package would result in an incomplete assessment of system risks and needed security controls. The fourth challenge should not be underestimated. It is achieving optimal enrollment. Because of the compressed timeline, states have not been able to devote the necessary resources to outreach and education. Tens of thousands of consumers, if not hundreds of thousands of consumers, will come to these exchanges with little or no prior exposure to health insurance coverage. They will need comprehensive assistance to be able to make these very important decisions. A lack of information and a high potential for misinformation will increase the likelihood for error, increase the possibility consumers will select suboptimal products, and possibly result in a delayed enrollment. In conclusion, Mr. Chairman, let me restate that although Levitt Partners believes that baseline functionality of state-based exchanges will be up and running in 3 weeks, it can be expected that due to the challenges associated with, number one, the complexity of the IT exchange infrastructure and architecture, number two, the Federal Data Services Hub, three, privacy and security, and finally, four, the necessary arrangements and outreach associated with achieving optimal enrollment, very few states will have a comprehensive working exchange on October 1st. This will result in a rocky enrollment period. Thank you.
Chair thanks, gentlemen, and now recognize Ms. Kraus, 5 minutes for an opening statement.
Mr. Chairman and members of the committee, thank you for the opportunity to speak on the implementation of the Affordable Care Act in Pennsylvania. I'm the director of the Pennsylvania Health Access Network. We are a statewide coalition representing over 60 organizations and 1 million Pennsylvanian consumers. Some of our partners include local health centers, physician groups, churches, retiree associations, and community groups. Our mission is to make sure every Pennsylvanian has access to quality, affordable health care. In my work, I meet people from all walks of life, working moms and dads, retirees, young adults, laid-off workers, and small business owners. They come from different backgrounds and live in different places, but their fears and anxieties over health care are all the same. How do I find coverage? Can I afford to keep it? What do I do now that I've been denied because of a pre-existing condition? Thankfully, we have the opportunity to address these fears and relieve the anxiety that so many of our neighbors and your constituents live with daily. We can do that by moving forward to fully implement the Affordable Care Act in Pennsylvania. We can often get caught up in talking about the mechanics of implementing this law, but we should never lose sight of what it means for working families. Already in Pennsylvania, the Affordable Care Act has brought 177,000 children with pre-existing conditions freedom from no longer being denied coverage, a boost for the bottom line of 160,000 small businesses who are eligible for tax credits, stability for 91,000 young adults who have been able to stay covered on their parents' insurance. And soon, in just 21 days, all Pennsylvanians will enjoy the freedom and feel the security that comes with knowing that affordable health care is within reach, no matter where you work, how much you earn, or if you've been sick in the past. I want to tell you about two of these folks, Karen and Gary Capanello. They live in Waterford, which is a small town in Erie County. Karen and Gary own their own small business, a commercial cleaning company. For the last 2 years, Karen and Gary have been uninsured. The couple makes too much to qualify for Medicaid, but nowhere near enough to afford the prices charged to people with pre-existing conditions. Gary has heart problems and Karen has a torn tendon in her foot. Karen worries every day about Gary and all the things he's forced to put off. She's scared that if the couple continues to delay treatment, they might not be around to see their youngest son, Tony, graduate from high school. That's a fear no mom should have, especially one who works as hard as Karen. Thankfully, Karen and Gary won't have to live with fear much longer. On October 1st, they'll be able to start looking for coverage in the health insurance marketplace. They'll choose from the same plans as all of you. They'll have quality options that will cover the services Karen needs to fix her foot and the preventative care Gary needs to keep his heart healthy. We are less than a month away from the day the door opens to 1.2 million Pennsylvanians who are sitting where Karen and Gary are today, on the outside of our healthcare system, looking in, hoping, praying, waiting to get in, and to get the care they need. The Affordable Care Act opens that door. Political posturing, partisanship, and delays threaten to keep it slammed shut. Unfortunately, in Pennsylvania, we've seen our governor, Tom Corbett, work to block 1.2 million uninsured Pennsylvanians from feeling the full benefit of the Affordable Care Act. While the new law gave each state the flexibility and tools to create a marketplace that fosters real competition, offers family and small businesses the best quality choices, and ensures rates are reasonable, Pennsylvania, like several other states, chose to reject this opportunity and relinquish its responsibilities to the federal government. Instead of working in the best interests of our Commonwealth, Pennsylvania officials have been slow to implement the Affordable Care Act, delaying and defaulting on key provisions of the law. I want to be very clear about what's at stake for Pennsylvania in its decision over Medicaid expansion. The choice Governor Corbett and state House leaders make will determine whether or not our Commonwealth brings in $43 billion in new federal funding over the next decade, whether or not we create up to 40,000 family-sustaining jobs, whether we continue to burden taxpayers with $1 billion in uncompensated care, and whether or not we leave 400,000 Pennsylvanians shut out from getting affordable coverage. Too many hardworking Pennsylvanians are forced to gamble every day with their lives and their livelihoods. They're counting down the days until they can sign up for coverage in the marketplace, and they're praying that Governor Corbett will move forward with Medicaid expansion. They're looking forward to secure coverage, no matter what their economic situation is. There is a fundamental opportunity in the Affordable Care Act, the chance to make our future secure, the chance for us and working families and small business owners to be in control. We know there will be bumps along the way, as there always are with any new major piece of legislation. Medicare and Social Security didn't enjoy a perfect rollout. There were challenges, tweaks, and changes along the way. But we worked together to make those laws work for the American people. That's what we need to do today. The Affordable Care Act has already made the lives of millions of Pennsylvanians better. And if we get out of the way and let it work, this law will open the door to stable, quality, affordable health care for 1.2 million of our uninsured neighbors. Too many lives and too many livelihoods are on the line to keep that door shut. Thank you for allowing me to testify today, and I look forward to your questions.
Chair thanks gentlelady. Now recognize Mr. Lentz, 5 minutes for your opening statement.
Morning, Mr. Chairman, members of the subcommittee. I am senior counsel of the American Staffing Association, which is a founding member of the Employers for Flexibility in Healthcare Coalition, which is called eFlex, and I'm appearing today on behalf of the coalition. eFlex represents leading trade associations and businesses in the retail, restaurant, hospitality, construction, temporary staffing, supermarket, and other service-related industries. It also represents employer-sponsored health plans that insure millions of American workers. The coalition strongly supports employer-sponsored coverage, and we've been working to ensure that it remains a vibrant and competitive option under the ACA. Our members employ a major portion of the U.S. workforce each year, upwards of 30 million people. We offer flexible work opportunities, and the jobs we create are leading the jobs recovery. But the high turnover rates and the fluctuating work schedules of our employees pose unique challenges in offering ACA-compliant health coverage. And we've been working with the administration to address those challenges in a way that does not impose unnecessary operational complexity that could disrupt our workforces or the labor markets. To that end, proposed regulations issued earlier in the year would allow a look-back measurement period to determine the full-time status of so-called variable hour employees for purposes of offering coverage. But offering coverage is only part of the equation. Many other issues affecting employers, which are integrally related to the employer mandate and the offer of coverage, have not been resolved. For example, the processes for determining employee eligibility for premium tax assistance and the employer reporting requirements. And for that reason, eFlex members supported the administration's one-year delay in enforcement of the employer mandate. As you know, the administration issued proposed employer reporting rules just last week. We've not fully evaluated the proposal, but our initial reaction is that they do not take the holistic approach that we've been urging that takes into account all of the processes affecting employers' coverage obligations, especially the process for determining eligibility for subsidies and the interaction between employers, health insurance exchanges, and the multiple federal agencies involved in making those determinations. Given that our members' software and other systems must be in place by January 1st of this coming year to start tracking employees' hours in order to get ready for 2015, the absence of final reporting rules creates major uncertainty for employers as they head into the coming year. I'd like to touch briefly on three other major issues of concern to eFlex. First is the definition of full-time employee under the ACA. Full-time, as you know, is defined as 30 hours per week. It's below what most employers consider to be full-time, and unfortunately it is creating perverse economic incentives to reduce employee hours. We think that increasing hours to 35 or 40 would benefit employees by increasing their take-home pay, allowing employers to offer better health coverage, allowing for more flexible employee work schedules, and interestingly, also because of how the Medicaid and ACA tax credit eligibility rules work, increasing the hours would actually allow more lower-income employees to be eligible for those benefits. The 30-hour definition is already having an adverse impact in the market. We see that. And once those changes occur, employees won't be able to recapture the lost wages, the flexible hours, or the better benefits that they might otherwise have had. So we strongly encourage Congress to act now to bring the definition of full-time employee more in line with current workforce practices. Another key issue is the definition of large employer. The ACA defines a large employer as one having 50 or more full-time employees, including full-time equivalent employees. Full-time equivalents, the inclusion of full-time equivalents, greatly expands the scope of the law to cover many smaller businesses, and our concern is that this will stifle their ability to manage their workforces and in some cases may even discourage them from expanding their businesses or offering health coverage. Finally, we remain concerned about the law's requirement that large employers enroll full-time employees into coverage automatically if an employee does not make an election. We think it is inappropriate to enroll employees in coverage they didn't select and may not want or need. It would impose a major administrative burden on employers and would result in unexpected and certainly undesired payroll deductions for many employees. We greatly appreciate the opportunity to present the views of eFlex, and we look forward to continuing to work with you and the administration to resolve the many outstanding issues that remain to be addressed. Thank you.
Chair, thanks, gentlemen. Now recognize Ms. Campbell, 5 minutes for an opening statement.
Good morning, Chairman Pitts, Congressman Pallone, members of the committee. Thank you very much for the opportunity to appear before you today. My name is Cheryl Campbell. I'm a Senior Vice President at CGI Federal, a company that has provided information technology services to the federal government for more than 36 years. In my role, I lead CGI Federal's Health and Compliance Business Unit. I am responsible for all projects at the Department of Health and Human Services and several other federal agencies. It is my pleasure to appear today to discuss CGI Federal's role as the contractor designing and developing the IT application known as the Federally Facilitated Marketplace, which I will call the Marketplace. This application is one of several components being developed that will allow citizens, health insurance issuers, CMS, and many states to participate in the Marketplace for Health Insurance, mandated by the Patient Protection and Affordable Care Act. CMS conducted a competitive procurement and on September 30th, 2011, selected CGI Federal to design and develop the marketplace consistent with requirements established by CMS. At the time of contract award, most of these requirements were not fully defined. For that reason, the contract was issued as a cost reimbursement type contract, and the project's original scope was defined broadly. During the course of performance, CMS has modified the contract on several occasions, generally in response to more detailed requirements. CGI Federal's scope of work includes the following 3 work streams. First, architecting and developing a marketplace that may be used by any state that opts out of building and operating its own. Second, designing an IT solution that is adaptable and modular to accommodate the implementation of additional functional requirements and services. And third, participating in a collaborative environment and relationship in support of coordination between CMS and its primary partners. When open enrollment begins on October 1, 2013, the marketplace will have 3 key functions to assist citizens in comparing, selecting, and enrolling in qualified health plans. First, eligibility and enrollment, which serves as the front door for consumers to determine eligibility for and enroll in a qualified plan. Second, plan management, which serves as the entry point for health insurers to submit their plans for CMS certification as qualified health plans. And third, financial management, which allows CMS to manage financial transactions with issuers. The IT solution developed by CGI Federal has been structured to support CMS as it provides 3 implementation model options to the states: the federally facilitated marketplace, the state partnership marketplace, and the state-based marketplace. To date, the marketplace implementation has achieved all of its key milestones, from the initial architecture review in October 2011 to project baseline review in March 2012, and most recently, the operational readiness review in September 2013. Additionally, in April 2013, health insurers began submitting their plans to the system for review by CMS. Starting in August 2013, consumers were able to go into the system and register their accounts. At this time, CGI Federal is confident that it will deliver the functionality that CMS has directed to enable qualified individuals to begin enrolling in coverage when the initial enrollment periods begin on October 1, 2013. Moving forward, CGI Federal is confident in its ability to deliver successfully on its contract and remains committed to the success of the marketplace as a mechanism for providing health insurance coverage by the statutory deadline of January 1, 2014. I appreciate the opportunity to appear before you today and would be pleased to answer any questions that you may have. Thank you.
Chair, thanks, gentlelady. Now recognize Mr. Lau, 5 minutes for an opening statement.
Good morning, Mr. Chairman. Is the microphone on?
Is your light on?
Green light is on, yes.
Okay.
Oops, there it is. Okay. Good morning, Mr. Chairman, Congressman Pallone, other members of the subcommittee. My name is John Lau. I represent Serco, Inc., and I'm the program director for our CMS contract. Thank you for the opportunity to appear today and to discuss Serco's role in this program. For the next several minutes, I will provide you with an overview of Serco, my background, the contract we've been awarded, and the status of our work to date. Serco is a U.S. company based in Reston, Virginia, and we employ over 8,000 Americans across 45 states. We provide professional, technology, and management services primarily to the U.S. government, and our customers include every branch of the U.S. military, numerous federal civilian agencies, and the intelligence community. We are a wholly owned subsidiary of the Serco Group, PLC, headquartered in the UK. However, Serco Inc. maintains a separate board of directors and separate management under the terms of a special security agreement with the Department of Defense. Serco has decades of award-winning experience in government-related records management and processing support programs. Examples of this experience include processing large volumes of visa applications for the Department of State, patent application processing and classification for the U.S. Commerce's Patent and Trademark Office, records management and application and petition processing for the Department of Homeland Security, and records management services at the U.S. Citizenship and Immigration Services National Benefits Center. Personally, I have over 30 years of experience specializing in implementation and management of large health and human services programs such as Medicaid and other public assistance programs. I've been responsible for overseeing eligibility and enrollment support programs for up to 30 million citizens involving 50 million or more transactions per year. Those experiences include the California State Children's Health Insurance Program, the Texas Eligibility Support System for Medicaid, Children's Health Insurance Program, food stamps, and at the time, temporary assistance for needy families. This experience gives me the confidence to say that our team is dedicated and equipped to deliver on our contractual commitments. Under the CMS contract, which is awarded to us on July 1st, we'll provide support services in the determination of eligibility for the federally facilitated marketplace and the state-based marketplace for the eligibility support tasks under the Affordable Care Act. The contract tasks include intake, routing, review, troubleshooting of applications submitted for enrollment into a qualified health plan and for insurance affordability programs, including but not limited to advanced payment of premium tax credits, cost-sharing reductions, Medicaid, Children's Health Insurance Program, and the Basic Health Program where applicable, beginning on October 1st, 2013. It includes 10 base tasks and potentially 3 optional tasks. And in my written testimony, I have a lot more detail on those tasks, which I think it's best in the interest of time to review there. The funded base year of the contract totals $114 million and some, and our role is to support a process that is as efficient, accurate, and protective of personal privacy as is technologically possible. Just in the note of full disclosure, there are 2 pending modifications to our contract. which may change some of the scope that we currently have. However, we are prepared to manage the estimated 6.2 million paper applications, representing about 30% of the total applications projected to be received between October 1st and March 31st, 2014. We don't do recruitment of Americans to submit applications, nor are we involved in eligibility or enrollment decisions. We're on schedule to deliver all requirements for our contract, and I look forward and happy to answer any questions you might have.
Chair thanks, gentlemen. Now recognize Ms. Spellacy, 5 minutes for opening statement.
Good morning, Chairman Pitts, Congressman Pallone, and distinguished members of the subcommittee. My name is Lynn Spellacy, and I serve as Senior Director and Corporate Counsel for Equifax Workforce Solutions. In that role, I am the primary attorney responsible for the day-to-day legal operations of the business unit, and I provide guidance, advice, and legal support. I appreciate the opportunity today to provide information related to the income verification services that Equifax Workforce Solutions will be providing to CMS to assist them in their benefit eligibility determination requirements under the Affordable Care Act. Equifax Workforce Solutions is a wholly owned subsidiary of Equifax Incorporated. Workforce Solutions provides employers with various human resources related services. We serve employer clients by providing services like unemployment claims management, W-2 processing, I-9 management, and similar other functions. One of the largest parts of our business is providing income verification on behalf of employers. Workforce Solutions responds to requests for employment and income information on behalf of our employer clients so that the employers do not have to devote resources to answering the phone and dealing with these requests, which typically come from lenders, social services agencies, and any other entity that has the need to verify a consumer's employment or income information. In order to provide this service for our employer clients, our clients send us a data feed every time they process their payroll, so every couple of weeks usually. This feed contains information regarding their employees' salary information and employment history. We take that information and store it in a database that we call the work number. We then accept requests from verifier clients, the lenders, social services agencies, and others mentioned previously, and provide consumer employment and income information in response to those verifier requests. The work number is a consumer reporting database that is regulated by the Consumer Financial Protection Bureau and is subject to the Federal Fair Credit Reporting Act. Therefore, we credential all of our verifier clients to be sure that the entity making the request is entitled to receive the information that they are requesting. Subject to federal laws, we make sure that the verifier client has a permissible purpose to access the data. And we require that the verifier obtain consumer consent before we release income information. By providing automated access to employment and income information, we alleviate the need for employers to have human resources staff verifying income when their employees are seeking a loan, for example. On the verification side, we can give verifiers the information so that they can process loans more quickly and reliably. Similarly, the process benefits consumers because consumers can obtain more ready access to credit and to the services for which they have applied without the delays caused by having to manually obtain pay stubs and provide them to lenders and others. Our contract with CMS is to provide the same services we provide to thousands of other social services agencies and lenders every day. In late November, CMS issued a request for proposals to provide automated income and employment verification to the CMS Hub in order to enable CMS to make its determination of consumer eligibility for tax credits and then programs like Medicaid and CHIP. We responded to that RFP, and we were notified at the end of March of this year that we had won the RFP. We entered into a contract with CMS at the beginning of April. The contract is a one-year contract, renewable for up to 5 years. We will be doing verifications similar to what we provide to other clients. CMS will provide us with information from a consumer who has requested qualification for Medicaid, CHIP, or a tax subsidy or reduced cost sharing. CMS will obtain the consumer's consent to have their employment and income information verified. In response to CMS's request, we will provide CMS with income and employment information that we have stored in the work number database. CMS will use that information to enable a determination as to whether that individual is eligible for CHIP, Medicaid, and a tax subsidy or reduced cost sharing. Equifax Workforce Solutions is prepared to provide income verifications to CMS. We operate in a closely regulated environment in accordance with federal law, and consumers provide their written consent to CMS before we verify their income. The configuration between Equifax Workforce Solutions and the CMS Data Hub has been tested, and we stand by our commitment to maintain the highest standards for information security and consumer data privacy. Thank you for the opportunity to testify, and I welcome your questions.
Chair, thanks, gentlelady. Now recognize Mr. Finkel, 5 minutes for his opening statement.
Good morning, Chairman Pitts, Ranking Member Pallone, and members of the subcommittee. My name is Michael Finkel, and I'm the Executive Vice President for Program Delivery at QSSI. My role is to ensure successful project delivery and implementation. I have worked in the IT field for 17 years and managed the delivery of numerous government programs. QSSI is a leading systems integrator that designs and builds custom IT systems, and we've been working with CMS since 2006. Currently, QSSI is one of several contractors developing systems at the direction of CMS that will support health insurance marketplaces, commonly known as exchanges. While we do various work with CMS in this area, today I will focus on QSSI's role in developing the Data Services Hub on behalf of CMS. Our job is to write the software code based on CMS-approved specifications for the Data Services Hub. We expect the Data Services Hub will be ready for CMS to operate as planned on October 1st. In simple terms, the Data Services Hub will transfer data. It will facilitate the process of verifying applicant information by routing queries and responses between given marketplaces and various data sources. The Data Services Hub itself will not determine consumer eligibility, it will not determine which health plans are available in the marketplace, and it will not handle personal medical records. Here's how it will work. A consumer will go to the Health Insurance Marketplace web portal to fill out enrollment forms and select health insurance plan. Certain information the consumer provides to the marketplace, such as citizenship, will have to be verified. The marketplace will direct a query to external information sources, such as government databases. Those queries will be funneled through the Data Services Hub. Once the requested information is sent back, eligible consumers can then enroll in one of the available plans. The enrollment data, such as name, address, premium amount, will be transferred through the Data Services Hub from the originating marketplace to the health plan chosen by the consumer. It is important to keep in mind that CMS owns and will operate the hub. It is housed in the CMS secure cloud hosted at the Terramark Data Center. We are developing the hub within CMS's environment where it will remain. Let me address the status of this work. I can report that our delivery milestones for the Data Services Hub are being met on time. We have completed software coding for the Data Services Hub for all functionality required for October 1st. We are continuing performance and integration testing. We have connected the Data Services Hub to the databases at the key federal agencies that will be used for verifying information. We have connected the Data Services Hub to the system that will transfer data to and from health plan issuers. We expect the Data Services functionality planned for October 1st to be ready. Finally, let me turn to data security. As I said earlier, the Data Services Hub is located in the CMS Secure Cloud. CMS and its information security contractors will continually monitor the Data Services Hub. Government regulations require CMS to follow National Institute of Standards and Technology security guidelines applicable to the Data Services Hub. The design and development of the Data Services Hub complies with these standards. Additionally, the Data Services Hub has recently underwent an independent security risk assessment by CMS's security assessment contractor, the MITRE Corporation. Our understanding is that that assessment did not identify any issues that would prevent CMS from launching the Data Services Hub on October 1st. Once in production, CMS will enforce additional security controls to protect systems, including controlling access and changes to the system. The Data Services Hub will continually be monitored by CMS and its information security contractors. Thank you for the opportunity to testify today. I'll be happy to answer any questions you might have.
Chair, thanks, gentlemen. Thanks all the witnesses for your testimony, and we will now begin questioning and answering. I'll begin the questioning and recognize myself 5 minutes for that purpose. Mr. Graham, in your testimony, you included a chart and we'll put it up on the screen, which displays the sheer complexity of the exchange, enrollment, and subsidy eligibility process. And I'd like to walk through this chart to help our constituents as to what they will face interacting with the exchange and what happens to the data provided on the application.
Sure.
So I have a series of questions I'd like to ask you.
Great.
My constituents may apply for enrollment through a paper application, is that correct?
Mm-hmm.
She could also apply online, is that correct?
Correct.
It's also possible to apply by phone, is that correct?
Correct.
A navigator or an in-person consumer assister could also be involved, is that correct?
That is correct.
And so the navigators and others will have access to personal information, including on the application, such as Social Security number, date of birth, address, and household income. Is that correct?
That is my understanding.
There would have to be a check on whether an individual is eligible for Medicaid, and the application information would then need to be transferred to the state. Is that correct?
That is correct.
The Federal Data Services Hub will have to route information to several agencies as well. Is that correct?
That is correct.
A check will occur with Homeland Security to verify residency as well. Is that correct?
That is correct.
The Social Security Administration will have to verify citizenship. Is that correct?
Yes.
The IRS will also check prior year income. Is that right?
Yes.
If household income doesn't match, CMS will check income verification with a private contractor. Is that correct?
Yes.
If the private contractor does not have data on file, CMS claims they will conduct an audit to check her eligibility. Is that right?
Yes.
Individuals with affordable employer-sponsored coverage are not eligible for a subsidy. There may have to be a phone call made to an applicant's employer to verify this. Is that correct?
There would be verification needed, yes.
The exchange interface will show approved plan options upon the entering of application information. Is that correct?
Correct.
Then the beneficiary premium will have to be calculated correctly after the household income and size is considered. Is that correct?
Yes.
Paper documentation verifying information on the application may or may not be asked of the beneficiary. Is that correct?
Correct.
Treasury will be responsible for making sure a payment is then sent to the plan. Is that right?
Correct.
Based on the application's information, cost-sharing subsidies will be calculated based on actuarial value, and payments will then be sent to plans accordingly. Is that correct?
Correct.
Overpayments and underpayments of subsidies will be dealt with during a reconciliation process, both for the plan. Is that correct?
Correct. There will be a reconciliation process afterwards.
Is there a similar reconciliation process for the beneficiary?
So, for the beneficiary, what do you mean by that?
The tax credits for the individual?
So if an individual receives too many tax credits because they have reported incorrect or their income status changes throughout the year, there would be a reconciliation process.
And what happens if there's incorrect information?
So it is projected that if an individual receives too much subsidy based upon either the information they submit or the change in income throughout the year, then they would owe the repayment of whatever additional subsidy they received throughout the year.
Would that clawback come back from the insurance companies or from the individual's income?
It would come from the individual's income. They would owe it.
Well, now I don't have much time left. I've just gone through 20 steps of the complexities associated with the ACA exchange enrollment. I'm a little skeptical this system can actually function as advertised on October 1st, given the myriad of missed deadlines by the administration, and I'm afraid this Rube Goldberg experiment will not end well. Trillions of taxpayer dollars are at stake. and it's our duty to watch this closely as we approach open enrollment. I wish I could go further, but my time is up, and I will yield to the ranking member. 5 minutes for questions.
Mr. Chairman, because I didn't have time before, I just wanted to respond to this notion that somehow, on the Republican part, that somehow this letter that was sent out to navigators, including the food bank of Monmouth and Ocean County in my district, was somehow an appropriate oversight function, which I don't think it is. First of all, you should understand, and I could use the food bank as an example, that they have just begun the process of trying to sign up people who are uninsured that happen to come to the food bank. And normally, when we have oversight functions, it's after the program's actually been implemented, not before it even begins. My concern is that it's solely designed, that this letter is solely designed to cause delay and to basically take resources away from the outreach effort of an organization like the food bank. And there has been no evidence that there has been any mishandling of these funds, particularly since most of the funds haven't even been used. So when I say that that oversight function is inappropriate, it's because it's not consistent with what we usually do in the committee. We don't usually start oversight and ask for a myriad of questions before the program has even begun and before there's any indication that there's any kind of misuse of funds. So that's why I say it's strictly a delaying tactic and trying to intimidate these organizations such as the food bank from actually trying to sign up the uninsured. I wanted to ask two questions. We hear all this over-top criticism of the ACA and the implementation process from my Republican colleagues. And as the supplemental memo the staff released today shows, the contractors here today are working hard to do a good job. But I just wanted to go down the line and ask the contractors whether they agree or disagree with my characterization. And I'll start, from the left. Granting that there may be hiccups and unanticipated issues, are you on track to deliver on your contract and have things up and running, or is this whole implementation effort doomed to failure? I know you've sort of answered this, so maybe I'll just ask yes or no, whether you're on track to deliver and have things up and running, or you think it's hopeless. If you could just say quickly, I'll run down the line, starting with Mr. Graham, I guess, or starting with Ms. Kraus, whatever. Go ahead.
So Levitt Partners is not building any.
You're not
machines,
involved.
So we're not a
okay,
contractor.
Ms. Kraus.
We're not a contractor.
Okay, then let's start with the
So I'm the first one
Okay,
on the
go ahead.
contractor
I'm
side.
sorry.
The answer would be yes.
Okay.
We're prepared.
Yes, Circa was prepared.
Equifax Workforce Solutions is prepared.
QSSI is on schedule.
All right, thank you so much. And this is the reality. It simply doesn't match up with my Republican colleagues' over-the-top rhetoric. Those working to implement this law are doing difficult but important work. Not everything's going to go perfectly, but we have an obligation to work together to make this law work for the American people. And obviously, those who are the contractors are not having a problem in terms of getting up and running. So I want to ask a second question of Ms. Kraus, if I could. My Republican colleagues seem intent on using this hearing to argue that the Affordable Care Act is not ready to be implemented. They're looking for the smallest missed deadline and using any indication of the difficulty of this task to argue that implementation is failing. And I think, again, we need to put this in perspective. Whatever implementation hiccups or glitches we see from here, the negative effects will be nothing, in my opinion, compared to the harm governors around this nation are doing to their citizens by rejecting the ACA's Medicaid expansion. So, Ms. Kraus, can you put this in perspective for us? What can you tell us about the very real harm your state's decision not to expand Medicaid is going to have, and how does that compare to, say, a week delay in testing IT readiness?
Thank you. So just to put it in perspective, so on October 1st, there'll be approximately 400,000 Pennsylvanians that will not have access to health insurance. They will not be able to get tax credits on the exchange. They can't qualify for health insurance now. So they're going to continue to be forced to go to Pennsylvania's emergency rooms. Hospitals, as part of the Affordable Care Act, are facing cuts in uncompensated care. And in Pennsylvania, hospitals face about $1 billion a year in uncompensated care costs, and they're still going to have to pay for that. In addition, the economic benefits to Pennsylvania by accepting federal funding is huge. We're looking at, $3 billion a year in increased economic activity. Our own independent fiscal office, which is a nonpartisan group, looked at it. We're looking at, being able to create 40,000 jobs in Pennsylvania each year alone from Medicaid dollars. Pennsylvania taxpayers are going to continue to have to shoulder the cost of uncompensated care and paying for folks that end up in the emergency room. So as we look forward to October 1st, this is going to cause a big problem for 400,000 Pennsylvanians. In terms of IT infrastructure, we have 1.2 million uninsured in Pennsylvania. About 1.1 million will qualify for the exchange and Medicaid expansion if we go down that road. These are folks that have been uninsured, for a long time, have been shut out of the market because they have a pre-existing condition, and these folks are just counting down the days until October 1st. Their survival counts on it. Right now, they have to choose between, feeding their family or figuring out how to pay medical bills. We hear all of the time from clients who, have ended up in the emergency room. They don't have health insurance. They have huge bills. They don't know how they're going to pay them, and they don't know where they're going to turn next. So on October 1st, they'll be able to start the process to making sure they have financial security and nothing like this happens.
Great, let's wrap it up there. Gentleman's time has expired, and I'll recognize myself for 5 minutes for questions. Mr. Lau, your contract was awarded on July 1st of this year, is that correct?
Yes, Congressman.
So on July 2nd, things changed, didn't they, as far as the employer mandate was concerned?
Correct, yes.
So were you prepared for that contingency? Was this something that had been discussed as you were tendering that contract?
Well, at that stage, we were prepared because we were just really getting started then. So there was not a change of course that was required.
Had you been to the White House and talked to the administration about some of these changes that they were contemplating?
No, Congressman, no.
Ms. Campbell, let me ask you, at any point have you or CGI been to the White House to discuss the potential changes that were coming to the Affordable Care Act, the contingency plans that they were laying?
No, sir, we have not.
And Mr. Lentz, how about yourself?
Well, we're not contractors, sir, so we've had discussions with the administration in respect to the employer mandate, but not with respect to implementation of the infrastructure.
But in regards to the employer mandate, what were those discussions?
Well, our group in particular had tremendous concern about implementation and specifically around the definition of who is a full-time employee, given the unique nature of our workforce. Lots of people that come and go, their work patterns are unpredictable and uncertain, and at least in that respect, the administration acknowledged that that posed significant problems, not just for employers, but also for the administration of the program. So we were able to agree on a look-back rule. The administration was accommodating in that respect, but as I noted in my opening remarks, it's not the whole, it doesn't answer all of the questions. We still have lots of questions relating to reporting, how the premium tax credits will be administered, and so on.
When did these meetings with the White House, when did they occur?
Well, they weren't, I wouldn't say they were at the White House. They were with the agencies that were responsible for the development of the rules, primarily Treasury.
Did you talk to them during the month of June?
I can't recall whether we actually spoke to them in June. We had several meetings with them.
Well, Mr. Lau, let me go back to your contract as a cost-plus arrangement. Is that correct?
That's correct.
And because of the changes that have occurred, well, if I am doing the arithmetic correctly, this will represent about 10% of your business. Is that correct?
The employer postponement, is that what you're?
No, just your contract.
Oh, would this represent? I don't know the exact percentage for Serco, but
well, you
may well be correct there. Yep.
Yeah, you record a cost, or your contract price was $114 million.
For the base year, yes, sir.
And your annual revenues are about $1.2 billion.
That's close to 10%.
Yes, sir. So this is a big deal for you all.
It is certainly a big deal, yes.
And, I mean, does it concern you that as you're working through a highly complex set of circumstances, does it concern you that things seem to be changing?
I think that things generally tend to change in complex programs like this. I've been doing these for 30 years. The company itself has lots of experience. And the one thing we know is that change is a constant. And sometimes the pace of that change increases as you get closer to the deadline.
See, and this is what
we are prepared to
Yeah.
accommodate and, adjust to whatever changes.
But look, we're, at the committee level, we invite members of the administration in. We expect to get answers to our questions. And the question about contingency plans and what are you doing to deal with the complexity of this program, really we get no answers. So your responses today are really the first that we've heard that the administration is in fact, or the agency is in fact considering the fact that things may not be exactly as they think. Mr. Graham, let me just ask you a question, because you used a word that I had actually used in questioning Mr. Cohen from the Office of Consumer Information and Insurance Oversight. You used the word descoping. Is that something that you've encountered in your study of this?
Yes, in fact, many of the state-based exchanges have been very public in their intent to. Some of the earliest ones were messaging their plan to descope as early as April. So it's the right thing to do for them to do given where they are.
Yeah, I don't disagree with that. But again, Mr. Cohen, in response to a direct question at the end of April, said no descoping, no delay. My time's expired. Let me recognize Mr. Green for 5 minutes for questions, please.
Thank you, Mr. Chairman. And one, I appreciate our panel being here today, because our oversight effort on the law now and coming from Texas, it's really important because we have a national plan. Our state decided not to participate. One of the things I want to talk about is the Affordable Care Act sets important nationwide standards on insurance plans and makes financial assistance available to those who need it. But the law preserves the state's primary role in regulating their insurance markets. The law was designed to be a floor and not a ceiling for consumer protections in the insurance market. It encourages states to set up their own health insurance marketplaces and tailor rules and regulations for them. But many states, including my own, have decided to turn over control of their health insurance marketplaces to the federal government. Handing keys to the federal government seems to be a strange way to be pro-states' rights, but that's their option. In contrast, states like Maryland and California have been running their own marketplaces and working to implement the law, have driven down insurance premiums, expanded options for small businesses, and helped simplify cost sharing and deductibles. Ms. Krause, what benefits can state realize by taking a more active part in implementation and setting up their own marketplaces? And how would things look in your state if they were taking a more active role?
Thank you. And like Texas, Pennsylvania has decided to default to the federal government. And doing that, we've given up a lot of flexibility, and we've really been slow to move forward. For example, we were the 40th state to submit our plans to integrate our IT. We submitted it after the deadline was passed, so that's slowing up the process in Pennsylvania. We've seen other states go above the Affordable Care Act standards. Oregon, for example, went above the requirements of the ACA in terms of rate review. This year, they brought in $69 million from waste, fraud, and abuse at looking at insurance plans and the marketplace in 2014. Other states have done things to strengthen their essential health benefits package. We defaulted to our largest small group plan. States have, defined habilitative services, providing, consumers with greater protection with disabilities. So we've really passed up the ability to be innovative and creative and really craft a marketplace that would work best for Pennsylvania.
I want to ask you about fraud and subsidies. We've heard this the last few weeks. In fact, the House may be voting tomorrow on it, about a particularly offensive attack. We've heard recently on health reform that the health insurance subsidies will be rife with fraud. Marketplaces will have robust verification of consumers' income before they receive any financial assistance, and the IRS will make sure no one receives excess subsidies when taxes are filed at the end of the year. There are penalties for perjury for lying to get these benefits, and the ACA even added new penalties for providing false information on the application. And yet we still hear what I consider slander of the hardworking people who get a little help from these programs are really just fraudsters trying to get benefits they're only eligible for. Mr. Krause, you work with many folks who might need little assistance from these important public programs. These people who are they just people looking for a free lunch, or are they actually willing to commit fraud to get it?
No, I mean, look, the majority of folks that would qualify in Pennsylvania for Medicaid expansion, about 80% of them have one full-time worker in the job. They're just trying to get health insurance to protect them and their families. I mean, I think you pointed out HHS has been very clear in setting up guidelines on protection against fraud and penalties for navigators that choose to not have security standards in place. If we look at how folks apply for health insurance today, you have to hand over an array of your health history, very private data. An insurance company can decide whether or not you have health insurance. Going forward, it's income, it's age, and geographic location. So, you know, to me, that's a lot safer than handing over very personal, detailed health insurance records.
Well, as we know, October 1st, at least on states like Pennsylvania and Texas, we're going to have a national plan with no state input. I'm not familiar with Pennsylvania law, but I know as a former state legislator in Texas, we tried to get, for example, 80% of the premium by statute. Does Pennsylvania have anything on the state level that requires a certain amount of the premium to go back to benefits like the Affordable Care Act does?
No, we don't. So the Affordable Care Act actually makes sure that, you know, Pennsylvania consumers are protected. And I think Pennsylvania, the average Pennsylvania consumer saw about $200 in a rebate this year from refunds for insurance companies that did not spend 80% on actual care.
Okay. Well, I appreciate that, because that's one of the things I hear from employers, that particularly small business, by going to their exchanges, and they can, starting October 1st, but they will be able to make sure that at least 80% of their premium dollar will come back to benefits.
Correct.
Thank you, Mr. Chairman.
Gentleman yields back his time. Chair now recognizes the gentlelady from Tennessee. 5 minutes for questions, please.
Thank you, Mr. Chairman, and thank you all for being here and for your testimony and allowing us to do the due diligence that our constituents expect for us. Can't hear me. Thank you, Renee. Mr. Lenz, I'd like to come to you, if I may, sir.
Yes, ma'am.
We have all been in our districts for 5 weeks, and I have to tell you, not a single day went by that I did not hear from employers or employees, and hearing about changes, reductions in benefits, uncertainty, confusion, and, you know, they say, well, the employer mandate, that delay for a year, still doesn't take away that underlying requirement. We know that it's still there, and it is going to be affecting jobs and job creators. All these mandates seem to just have a crushing effect. I met this morning with a group of business leaders from another state, and when I said our goal is to delay, defund, repeal, replace Obamacare and find something workable, they broke into applause, because in their state, just like in mine, it is a huge, huge problem. So what I'd like for you to do is take just a few seconds and expand on your testimony and kind of connect for us how the Obamacare requirements on employers are causing the job market to contract and not to grow.
Well, thank you, Ms. Blackburn. We do represent a specific group of employers and a specific concern in regard to what we sometimes refer to as variable hour employees, that is temporary part-time employees whose work patterns are intermittent, unpredictable, short-term, and so on. They present unique challenges under the statute. We certainly recognize that there is general concern on the part of employers about implementation, and we've addressed some of that in our own testimony. But I would have to confine my comments to the unique circumstances of our particular workforce, and there are lots of them. As I pointed out, there are upwards of 30 million employees that are in that category. And so we've made some progress, I think. We recognize that it is the law and that we're compelled to comply with it, but we still have major concerns about implementation, the timing of it. And as you pointed out, the fact that the employer mandate has been delayed a year does not mean that we don't have to be ready now. In fact, we had to be ready yesterday and 6 months ago, and we weren't and couldn't, in large part because rules weren't out that we could rely on, in particular regarding the reporting rules. Now, they just came out last week, and we're scrambling to look at them and to digest them. We were somewhat disappointed to see that some of the suggestions that we had urged that had not been adopted for various reasons, and we understand that there's lots of complexity associated with it, but it doesn't relieve the fact that we have major concerns about implementation on January 1st of this coming year, not 2015, because all these software programs have to be in place, up and running, so that employers can begin to track hours now in order to know who they have to offer coverage to on January 1, 2015. So this has been an ongoing problem in trying to get certainty and answers as to how we need to operate in order to comply.
Thank you. Mr. Lau, I want to talk with you a minute about Serco. You know, you're talking about all the data you've got to start holding now in order to be ready on 2015, January 1, 2015. And then as you look at the amount of information on your employees, well, one of the main problems that we hear about from our constituents, the main concerns is the lack of privacy that they're going to have and their lack of faith that people are going to be able to protect that personally identifying information, and the fear that some of that could be used against them. So what kind of provisions are you putting in place?
Well, Serco has a very comprehensive privacy and security program, beginning with security of the facility, thorough background checks on each and every employee that will work there, compartmentalization of the roles and functions of the employees, role-based security so that employees can only see certain parts of an applicant's record. We, by the way, deal with no personal health information. None of that's there. It's PII mostly. We also have extensive training and a cultural background to instill in all of our workers, you know, a respect for the information and the fact that it represents very personal information of people and citizens. In addition, there are a number of technological components as well in compliance with federal information security standards and NIST standards and things like that. So there are firewalls and other preventions so that the networks are not accessible to the internet. They're point-to-point networks. And so there's just layer after layer of security in place there.
Thank you. Yield back.
Chair, thanks, gentlelady. Now recognize the gentlelady from the Virgin Island, Dr. Christensen, for 5 minutes for questions.
Thank you, Mr. Chairman, and thank the panelists for being here this morning. I want to focus on some of the concerns Mr. Butterfield raised earlier. And Mr. Graham, in your testimony, you described consumer outreach as being very important. As a matter of fact, it's one of your 4 key areas of concern. By consumer outreach, I assume you mean advertising, public events, the Navigator program, and similar efforts to inform the public about their new insurance options in the exchange. Is that correct?
That is correct. When I say outreach, I mean just going out in the community and making consumers aware of their choices so that they might make the optimal choices for themselves.
And is it also important to make sure that the largest number of young people and healthy people are also engaged, taking advantage of the exchange so that the cost might be lower?
One of the changes that the ACA brought about was clearly how risk pools would be created. And as the risk pools are created, it certainly, as with any insurance product, it's necessary to have a broad spectrum of individuals in that pool. And so if the exchanges were not able to attract those individuals, there would be problems in subsequent years.
And so you would agree that states that are not doing the consumer outreach and education are likely to see higher costs than those who are more active?
Well, when you say higher costs overall or higher costs
of the premium?
Of the premium. So they run the risk of having not attracted the right risk pool or everyone into that risk pool, and so having premiums be higher in subsequent years.
And Ms. Krause, you agree also, I'm sure, that consumer education efforts are important to make this law work properly?
Yep, correct.
You know, it's good to see that witnesses invited by both Democrats and Republicans agreeing on something this important. I think it's unfortunate that the Republicans are attacking the HHS for investing in efforts to inform the public, and it's even more unfortunate that they're working to undermine the civic and community groups that are going to be doing some of that consumer outreach. And I hope we can agree, just as President Bush did with Medicare Part D, a robust consumer outreach and education campaign for these new insurance options is important, and we should all get behind it. I remember when we passed the Medicare Part D, it was not the Democrats' version of the bill. It created a donut hole. It didn't treat the territories equitably, and yet I went out across my community to do outreach to ensure that people understood the bill, and engaged our foundation in doing a lot of outreach across the country. And you know, I think that's the way we ought to go, instead of trying to undermine a law and unfund a law that's already helping individuals across the country. And Ms. Krause, I was in Pittsburgh about 2 weeks ago at a women's conference, and heard firsthand and personal the issues of health disparities and lack of insurance in that community, and it's extremely unfortunate that Medicaid expansion is not going to be accepted, even as you have said, where it creates jobs, helps the economy in Pittsburgh, and of course provides the services to many. This was a women's conference who are uninsured in the area. I think, you know, that really was the question that I wanted to ask Mr. Chairman, and I'll yield back the balance of my
Chair,
time.
thanks to the gentlelady. Recognize the gentleman from New Jersey, Mr. Lance. 5 minutes for questions.
Thank you, Mr. Chairman, and good morning to the panel. Mr. Graham, as I understand it, under the law, states will be responsible for accepting application transfers from an exchange where Medicaid eligibility needs to be determined. There has been some systems testing of such transfers where, in fact, Medicaid eligibility is valid. However, testing has not been completed for cases where Medicaid eligibility cannot be determined for various reasons, including an incomplete file. From your perspective, Mr. Graham, has there been sufficient testing with the states, and if not, what are some of the financial risks to the states?
So the question about has there been sufficient testing, one of the key things here is that it is different in every state, right? So that some states are further along in testing, and certainly more testing would be more beneficial. The risks of not having testing completed, or if something doesn't work as planned, is really delay for the consumer, and then delay for enrollment. So in those instances where things cannot be done in an automated or electronic way, then physical documents have to be faxed in or brought in some form or fashion, and interaction has to occur with the consumer that delays the actual process to be able to become enrolled. So the risk is delay.
And can you estimate how long that delay might be?
We know that HHS is required to be able to actually, in instances where it is goes to a manual system or has information brought in, it has a 90-day review period. So that's what the law requires. I can't estimate in terms of how long things might go out should there be challenges in Medicaid and HHS.
It would be my suspicion, at least, that it will be longer than 90 days. Do you share that suspicion?
I think delays tend to be longer than we originally expect.
Can you tell us, perhaps you don't know this, which states have done a good job so far in this regard, and which states need to do a better job?
I'd be happy to do that offline for you in terms of getting into specifics with states.
Thank you, Mr. Chairman, and I am willing to yield my time to anyone who would like it. Dr. Burgess?
If the gentleman would
certainly.
I'd like 30 seconds.
Whatever time the gentlelady would like.
Just a couple of minutes. Adding to your question, which I think was a great one on detailing the states, and you said you would talk with the congressman offline. I wish that you would submit that in writing so that it could be put into the record of the committee, and I yield back to Mr. Lance.
Thank you. Is there any other member on our side who would like, Mr.
If the
Chairman?
gentleman will yield.
Absolutely. I certainly will, Mr. Chairman.
Mr. Lynch, I had another question. In my opening statement, I mentioned that Eastern Lancaster County School District, Penn Manor School District in Lancaster, PA, both announced that they were outsourcing some employees to avoid cost of complying with the ACA's employer mandate. The school district simply cannot afford to pay for the additional expenses covering these individuals. Are you hearing similar stories or anecdotes like these from members of your coalition due to the ACA?
Yes, we are hearing questions being raised as to whether businesses or entities that would otherwise be subject to the ACA would try to outsource some of their workers in order to avoid the rules. It's not clear how that's actually going to play out, because the responsibility for employer coverage is going to be determined based on common law employer rules. So it really ultimately will be a legal question as to who the responsible employer is. We've addressed that at great length to our members of the American Staffing Association. I'm not speaking on behalf of EFLEX now, but the temporary staffing firms are in the business of supplying employees to other businesses that require temporary help or other contract help. And so there are questions as to, in those so-called third-party employment relationships, who is the actual employer. Our view is, if the temporary staffing firm, for example, is offering or providing compliant health care coverage, it shouldn't ultimately matter who technically the common law employer is, as long as the arrangement is not being used to circumvent the law. But those are technical questions. In some cases, they raise thorny issues, but they remain to be addressed as we go along.
Thank you. Gentleman's time has expired. Chair now recognizes the gentlelady from Florida, Ms. Castor, 5 minutes for questions.
Well, thank you, Mr. Chairman, and thank you to the panel. This is an important time in the enrollment or in the implementation of the Affordable Care Act, particularly with the online marketplaces about to come online in the open enrollment period that will run October to March. In my home state of Florida, it is particularly important. The U.S. Census Bureau reported over the last couple of weeks that 25% of the population in the state of Florida is uninsured. That's about 3.8 million individuals. Now, most people have insurance already, and that's good. And if you have insurance, you want other people to have insurance, because otherwise you're going to, part of your co-payment and premiums is going to go to subsidize folks who do not have insurance. And if you have insurance today, you've already seen the benefits of the Affordable Care Act. In essence, you have new rights. You cannot be discriminated against for pre-existing conditions. You cannot be kicked off your policy if you get sick. In the greater Tampa Bay area, we already have almost 50,000 young adults who have been able to stay on their parents' policies. That's very positive. Over 200,000 small businesses in the state of Florida are eligible for the new tax credits. That's very meaningful in a state that has so many mom and pop small businesses. One of my favorites for folks who have insurance today is the fact that just in the greater Tampa Bay area, over $47 million has come back into the pockets of families due to the new requirements that's 80 to 85% of your premiums and copays have to go to health insurance. So the rebates have come back to about 1 million people just in my greater community. But what concerns me now is that we're not all working together to address the flaws and improve the Affordable Care Act. Instead, we continue to run into obstruction. Last month, Ranking Member Waxman and the Democrats on this committee released an analysis describing the 10 ways that Republicans have acted to undermine and obstruct the Affordable Care Act. That's in addition to the 40 repeal votes that have taken up precious time here in the House this session. That's a waste of time. We've got to be working together on this. And then when you look across at the states, Republican governors, including mine, some have refused to take the Medicare expansion. In the state of Florida, that means that our hard-earned tax dollars that Floridians have paid are not going to come back to our state. $50 billion over the next 10 years. That's not smart. That's not in the public interest. But I wanted to highlight to my colleagues today the one that takes the cake, the one that wins the ideology over the public interest award. And that is the fact that in the state of Florida, the Republican legislature passed a law to actually remove state oversight and regulation of insurance companies and their rates. When Secretary Sebelius was in Florida a few weeks ago, she said she knew of no other state that had gone this far. The states still have the authority to negotiate and regulate insurance rates. So in this effort to elevate ideology and obstruction over the best interest of my neighbors, they now have taken the cops off the beat to regulate insurance rates. I want to know if anyone on this panel thinks that that is in the best interest of our businesses and consumers and families. I didn't think so. I haven't heard of anyone outside of the Republican legislature and our governor, even if they don't like Obamacare and the Affordable Care Act, that thinks it's reasonable for the state to put insurance companies in charge of where the rates go. I really think it's a shame. And like I said before, if you have insurance today, you want other folks to have insurance. Ms. Krause, I'd like to ask your perspective on these Republican efforts to undermine the law. What kind of impact are they having on the implementation? In your state, I can tell you in my state, it's very problematic.
Yeah, I mean, I just want to emphasize this again and really hit this home. Medicaid expansion is huge, and we're leaving 400,000 people without health insurance, and that affects every single person. It affects, as you said, folks that have health insurance. We're paying for that, and we're going to continue to have to pay for that. Like Florida, Pennsylvania's tax dollars are going to be thrown out the window to pay for health insurance coverage in other states. We're an island of no amongst other states. Our neighbors, New Jersey, Ohio, Maryland, they're all moving forward with Medicaid expansion.
Thank you. Now you're back.
Chair, thanks the gentlelady. The chair now recognizes the gentleman from Louisiana, Dr. Cassidy. 5 minutes for questions.
Thank you, Mr. Chairman. Mr. Graham, earlier there was a question suggesting that the possibility of fraud in this arrangement where there wouldn't be income verification was merely a straw horse. Straw man. I understand that under the Earned Income Tax Credit, it's estimated that 21 to 25% of the payments are fraudulent. And that's when a totally integrated hub with the IRS. Now, are you as comfortable that in states like California, where it's going to be self-attestation with no verification by the IRS, that the level of fraud will be less? Or what is your perspective as to what's going to happen?
I'm not an expert to project on what the fraud may or may not be. I will just say that in areas where the systems testing hasn't been completed or hasn't done at the full extent that it was originally intended to or needed, that the potential for fraud exists.
And knowing that we're all sinners and fall short of the glory of God, it seems reasonable that there could be some fraud, huh?
That is a reasonable expectation.
I mean, it's almost laughable to say that there won't be. And there's going to be $1 trillion spent on the healthcare exchanges over the next 10 years. The federal taxpayer is about to get whacked. Ms. Campbell, you mentioned that everything's kind of going well as regards the baseline, but it's my understanding that that the systems have not included foreign language support. And yet I've also read that the hope to get the big numbers, the young men who currently are not insured but will theoretically pay 3 times the market rate in order to participate in the exchange, will rely upon people who are minorities, many of whom will not have English as a primary language. So that said, is it true? I mean, you tell me, I don't know. Are the exchanges robust in terms of their ability to support folks for whom English is not a primary language?
So Spanish is part of the rollout for implementation.
But is it ready? Is the Spanish, put it this way, if I was a primary Spanish speaker, would I be able to log on and have a seamless experience as regards my ability to interface with the form?
For the online application, yes.
And what about Vietnamese?
I don't have an answer for that, but I can get back to you.
That would be great. Chinese, Mandarin?
I have an answer for the Spanish version. I can get back to you with the other dialects.
Okay, so for these other folks who perhaps are not currently insured in Orange County, which I gather Orange County has the greatest concentration of Vietnamese outside of Vietnam, may not be quite ready. Now, granted, a lot of those folks speak English, but still I'm a little interested. Mr. Lentz, I've heard the President's Healthcare Law described as one of the most significant anti-growth policies that have been passed by Congress. I'm proud to say I voted against it. And that we continue to see a declining unemployment rate, but only because people are dropping out of the job market. Total number of jobs is actually terrible. It's just that people are no longer looking for work. Now, and you described something along those lines. The businesses which you represent, or you say that they are encouraged to grow by this law, or perhaps they are otherwise encouraged?
Well, it's almost cliche to say that businesses don't respond well to uncertainty, and higher costs have an impact on hiring. Those are just basic business truths. I think our members believe that. I think we are in particularly concerned about the definition of full-time employee. As we mentioned, the 30-hour definition we think is not working well and is having perverse economic impacts already.
And if I may interrupt, also when I speak to small business owners, she will tell me that she's spending so much time thinking about this law, she's not actually thinking about how to expand her business. She's trying to not run afoul of the federal government as opposed to where do I next open up. Is that a fair statement?
Well, let me just say on behalf of the American Staffing Association, which represents temporary staffing companies, the great majority of which are small business owners. We have lots of employees that come and go, but most of them are small businesses by anybody's reckoning. There's tremendous anxiety about enforcement, very much confusion because of the complexity.
So it's fair to state, if they're confused at whatever, conflicted, then it's fair to say that they're not thinking of as much about expanding their business.
I think that's a fair statement.
Lastly, let me just make the point, Mrs. Krause, you've been very wonderful about how Pennsylvania is going to benefit from this, but let me just say that Pennsylvania's small group market has a projected 27% increase in their premiums. What else was my other form? That Pennsylvania's individual market, one insurer predicted an average increase of 30% in the individual market, males facing premium increases of 11 to 63%. Heck, it doesn't seem quite as good for the law in Pennsylvania if you're that male getting a 63% increase in your premium.
Well, I mean, I think a couple of things. First, when we talk about small businesses, we have to remember that small businesses with 50 or fewer employees are exempt from having to offer health insurance coverage. And I think when you go
So your only salvation is that you're exempt, huh?
No, but I mean, I think when you go out and talk to small business owners, a large concern is, you know, the cost of health insurance. We've seen health insurance costs rise astronomically over and over for years before the Affordable Care Act. And for the first time in history, insurance rates have slowed, and this year they only grew by 4%. So I think this is going to start to help small business owners that can now pool their power together and get coverage that's offered to
Based upon what the insurers said, it seems more an article of faith than something, it's a hope. It doesn't seem to be what the insurers are saying. I'm out of time. I yield back. Thank you.
Chair, thanks, gentlemen. Now recognize the ranking member of the full committee, Mr. Dingell, for 5 minutes for questions.
And our witnesses. First of all, I welcome the opportunity to hear from our witnesses today about the progress of ACA implementations. One misconception seems to be a big one is the data hub. These questions are for Mr. Finkel of Quality Software Services, Inc. Mr. Finkel, these are yes or no questions. QSSI has a contract with CMS to work on what is known as the data hub. Is that correct? Yes or no?
Yes.
Now, Mr. Finkel, we've heard from some that the data hub will be this new government database of personal medical information. Is this an accurate characterization of the program? Yes or no?
No.
Would you submit for the record what is a correct representation of the circumstances, please?
Yes.
All right. Now, instead, is it fair to say that Data Hub is a technological tool to help facilitate the transfer of data between government agencies? Yes or no?
Yes.
Now, will Data Hub handle personal medical records at all? Yes or no?
No.
Mr. Finkel, will the Data Hub be up and running 3 weeks from today on October 1? Yes or no?
Yes.
Could you please submit for the record a summary of the functions of Data Hub? That may relate to an earlier question I asked. Would you do that for me, please, sir?
We'll work with the committee on that, yes.
Very good. Work with me. This committee might not be quite as helpful. The next questions are for Mr. Lowe of Serco. Mr. Lowe, does Serco have experience in handling applications and records management for government agencies? Yes or no?
Yes.
CBO has estimated that 6.2 million paper applications will be submitted between October 1, 2013 and March 31, 2014. Does Serco have the capability to handle this large amount of paper applications? Yes or no?
Yes.
Now, Mr. Lowe, how many people has Serco hired to work on this CMS contract?
To date, 1,200. The plan is for about 2,000 by October 1st.
Now, if you'd want to submit more for the record, it would be appreciated. And now these questions for Mrs. Spellacy of Equifax. Ms. Spellacy, will Equifax get prior consent from a consumer before conducting an income verification report on that individual? Yes or no?
CMS will obtain the consent first, yes.
Thank you. Now, does this practice go above and beyond what is required of Equifax under the Fair Credit Reporting Act? Yes or no?
Yes.
Now, has Equifax done testing of your income verification systems with Data Hub and the state exchanges? Yes or no?
Yes.
Now, will income verification services provided by Equifax be ready in 3 weeks when the marketplaces are open, or rather are available for open enrollment? Yes or no?
Yes.
Now, I want to thank you all for your testimony. This is a critical time in our history. The American people are counting on us. When I was back home in Michigan just recently, my constituents weren't asking me political questions about about the Affordable Care Act. They wanted to know where and how to sign up for quality, affordable health care that will help their families and their small businesses. We have only 3 weeks before the marketplace is open. The time for political games is over, and it's time for this body, the Congress and the Senate, to quit playing games. It's also time for us to understand that we have to work together. The law is the law, and ACA is the law of the land. And frankly, we should all be working together to ensure that implementation goes smoothly as possible in the interest of seeing to it that we don't waste the hundreds of millions or perhaps billions of dollars that have been spent so far, and that we don't dissipate our opportunities to see to it that the American people can get a chance to say to it that health care is a matter of right, not a privilege just for those who are well-to-do. And I would observe that working men and women need this legislation. It's something which will help them to live a better quality of life and will improve medical care all across the board. I would also note that it is saving money for everybody in sight, and if we'll just give it a chance and work together, I believe the country will be better off for it. I thank you, Mr. Chairman.
Chair thanks the gentleman. Now recognize the gentleman from Virginia, Mr. Griffith, 5 minutes for questions.
Thank you, Mr. Chairman. I appreciate it very much. Appreciate all the witnesses being here. As you might gather, Mr. Dingell and I do not agree on this point, although I respect him greatly and appreciate his contributions over the many decades to this committee. And obviously, whenever you have a law on the books, it is Congress's obligation to review it, make sure it makes sense, and each Congress has a separate obligation to do that, and we come to somewhat different conclusions. Mr. Lentz, I noticed with some interest on your summary of major points at the very last point, you said it would impose a major administrative burden on employers and result, referring to the large employer auto-enroll requirement, and result in an unexpected payroll deduction for many employees who do not want it or need coverage. Am I to assume that you're referring to perhaps the husband whose wife has a much better plan with her employer, and now he's going to be automatically enrolled, albeit his wife has a better plan and has a family plan for them and their children? Is that the type of thing you're referencing?
That would be one example.
And would another example be the one that a constituent came to me with last year, or a similar situation, where a student full-time enrolled in college also held a full-time job, and through the Affordable Care Act was forced off of their parents' plan because they were eligible through their employer, and then they ended up having to spend more money because obviously being a part of a family plan with their parents, it was free, but now because they were doing what I hope my kids will have the fortitude to do, carry a full-time load and at school and a full-time job, it ended up costing them several $1,000s a year. Would that be another example of that kind of a problem that this act is just not ready for?
Yes, sir.
And I would ask the gentleman also, I noticed that on page 5 of your testimony you indicate that the one-year delay of the employer requirements means employers will not have penalty exposure until 2015, but they must still have their information technology and human resources systems in place by January 1, 2014 in order to track employers' hours of service in 2014 and comply with the ACA coverage obligations on January 1st, 2015. But I would ask you, Mr. Lentz, has your organization taken into consideration what happens if the courts determine that the president didn't have the authority? And I ask this question because I can't find where in the bill the president has the authority to delay the employer mandate. What if a court finds, let's say next September, that the president didn't have that authority? You all have got the records. Aren't your employers then responsible for going back in and reimbursing the cost of that health insurance to their employees that they thought they weren't mandated to provide, but now they are, if they hadn't provided something that would have been in compliance with ACA as of January 1, 2014?
Well, that would be quite a conundrum.
And isn't it a possibility, understanding that there's nothing directly authorizing the president to have delayed the employer mandate, and recognizing that we do live in a litigious society?
We do indeed, sir.
And so this conundrum could be a great detriment to many employers in the United States. And isn't it also just one of the thousands of examples out there of why you're concerned about employers not knowing what the rules are and what they have to do and what's coming next as a part of this act?
There are multiple opportunities for unforeseen consequences here.
There are indeed. There are indeed. I would go back to Mr. Graham. I was reminded when you were talking about the fraud, and I know you don't want to get on record as to what percentages of fraud or whether it'll be more or less, and I understand that. But a friend of mine once explained to me, and I thought it made good sense, that locks are just there to help keep the honest men and women honest, and that's why you have locks, because if there's somebody who really wants to get into your house or get into your car, they're going to figure out a way to get in. And so doesn't it cause you some concern that we don't have proper locks in place on fraud when it comes to this particular act and the various requirements that you say what your income is or don't say what your income is?
When I ride my bicycle to work, I lock it up.
Yes, sir. I appreciate your answer. Mr. Chairman, unless somebody wants my last 30 seconds, I yield back.
Chair thanks the gentleman, and now recognize the gentleman from Florida, Mr. Bilirakis.
Thank you very
5
much.
minutes for questions.
Thank you so much. Thanks for holding this hearing. I apologize for being late. I was at the other hearing. Question for Mr. Law. Did CMS in any of your conversations state why they waited until July to issue the contract?
No, it was a competitive procurement, so I'm not sure what.
Well, did they know that the paper processing required with the exchanges would go online? Do you usually get contracts affecting $6 million $6.2 million 3 months before any contract, before it occurs.
Well, this one was certainly more challenging than most in that regard, the time span.
Thank you. Question for Ms. Campbell. Ms. Campbell, can you talk about the CGI's role in the exchange? Do you make all final decisions for yourself and the subcontractors?
So I'd be happy to discuss the role of CGI and as our role on the exchanges. For us, I'd like to equate it to sort of the face of the exchange. This is where an individual will be able to go into a portal, sign up, actually put in a profile, peruse the database, or peruse the system to determine which plans of interest to themselves. They will also be able to determine their eligibility through a series of questions, and then they will make their selection. And that is the portal that CGI is developing for the marketplace or for the exchange.
Next question, Ms. Campbell, who is ultimately considered the integrator or quarterback for making sure the exchange works properly?
That would be CMS.
Thank you. Next question for Mr. Finkel. Will QSSI be operating the data service hub after open enrollment on October 1st and through 2014?
No. As I stated, the CMS will be operating the data services hub once it goes live.
Thank you. Another question. According to the Inspector General's office report, it says the CMS Chief Information Officer is expected to make his security authorization on September 30th. Is it responsible to make this decision so late in the process? The original timeline, I understand, was September 4th the decision would be made. Can you comment on that?
I cannot comment on the CMS and what they will approve and when. I can tell you that the Data Services Hub has gone through a security risk assessment that was completed on August 30th, and we have no reason to believe why CMS cannot sign off on the Data Services Hub.
Okay, thank you very much, Mr. Chairman. I appreciate it. I yield back.
Chair thanks the gentleman. That concludes the first round of questions. We'll have one follow-up on each side. Dr. Burgess, you have 5 minutes for a follow-up.
Thank you, Mr. Chairman. Ms. Campbell, let me just ask you, in your testimony, you referenced that your company has achieved all its milestones. And the last one you referenced was the operational readiness review in September of 2013. Do I understand that correctly?
That is correct.
Is that something you can make available to the subcommittee?
I can make available our report that we submitted to CMS.
Okay. Can you make that? Have you made it available to the committee?
We have not made that available to the committee.
Well, then I would ask that you, if you would, make that available to the committee, Mr. Chairman. When staff gets that, I would appreciate the opportunity to review it. And Mr. Graham, we talked just a little bit about descoping, and the reason this is important, and I'm not just picking on this, but look, February 1st, with the Elysian Fields of Obamacare still 11 months away, the window for application to the federal pre-existing program closed. And it closed rather suddenly without warning to the people who had been trying to go 6 months without health insurance to age into the program. So for almost a full year, the promise of coverage for pre-existing conditions has been an empty, hollow promise. The caps on out-of-pocket expenditures was very quietly delayed for a year. Apparently the press picked it up here the past month, but it was something that actually happened much earlier in the year. Of course, we've had the discussions about the employer mandate being delayed. There have been other pieces of this apparatus that have sort of fallen into the bar ditch on the way to October 1st and January 1st. When you all talk together, when all of the smart minds who are in charge of the outsourced implementation, when you get together, are there things that you talk about and speculate about that may be the next to go or the next shoe to drop as far as the pieces of the Affordable Care Act that may go by the wayside?
With respect to the descoping, when we look at what capabilities each of the state-based exchanges will have and which ones will be live on October 1 and those that are not, how long they will take to come up, we project that as in many IT implementations, it will be 3 or 6 months for many of those things to go. With respect to the law itself, there's a lot of talk about where that is. I don't know that I'm the best to comment on that.
You're all I've got. You know, honestly, and you know, as we look at this group assembled in front of us, you're an impressive group, and there are some impressive contracts that go with the work that you sell to the federal government. And with all respect to the ranking member of the subcommittee, I mean, a local Meals on Wheels outfit being able to do what you all are doing, and it's taken you months to do, and hundreds of millions of dollars in some cases, is it really responsible to expect that that some community organization is going to be able to accomplish what you all have been tasked to accomplish? And anybody's free to answer that question. I should do like Chairman Dinkle. I need a yes or no. I got no answer, so Mr. Chairman, I'm going to assume that is a no. Let me yield back the balance of my time in the interest of to other members of the committee. If someone wants to claim it, they may do so.
All right, thank you. Chair recognizes ranking member for follow-up.
Thank you. I'm glad Dr. Burgess brought up the navigators, or in my case, the food bank issue. You know, again, I want to ask a question of Ms. Kraus, but I disagree totally in terms of who should be a navigator. I mean, I mentioned the Food Bank of Monmouth and Ocean County, which is one of a number of organizations or nonprofits in New Jersey that you know, received a grant to act as a navigator, and now has been subject to these what I consider intimidation tactics by the Republicans on the committee. But I totally disagree with Dr. Burgess. If you the Food Bank of Monmouth and Ocean County, which I'm very familiar with, is my district, took on this responsibility because they just get, I don't know how many, hundreds or thousands of people that come to the food bank on a regular basis, and obviously a lot of them are uninsured, and a lot of them are probably people who are you know, maybe afraid to even admit that they're uninsured or go to a place to try to find insurance. And so I think they're excellent. I might use that as an example. They're an excellent organization that would actually be charged with trying to deal with the uninsured and navigate them so that they get insurance. And I think that's the whole purpose of these grants, is to try to find somebody who can play that role in a significant way, even if they don't have extensive background doing that. I commend them for taking on the role. But Ms. Kraus, my concern is that they may be intimidated, that resources are being taken away because they have to answer all these questions. At the same time that there's no evidence of any wrongdoing or any predicate for this kind of time-consuming and burdensome investigation that the GOP on this committee are going about. And you know, these are small community-based groups. The timing, I think, was very suspicious, imposing a burden on these groups before the October 1st rollout. It's only a few weeks away. So can you offer us some perspective on the importance of these navigators and the impact on implementation of the law if the Republicans' intimidation disrupts their efforts? I'm not asking you to say they're being intimidated, but I know that some have already suggested that they might just not proceed because of the questions and all the paperwork.
Yeah, I mean, look, 75% of those that are eligible for coverage have no idea that this is coming. The majority of them have never had access to health care before. So a fundamental piece of the Affordable Care Act was to place community organizations in these local communities to help folks that might need a little extra help. They're not building IT infrastructure. They're there to help people kind of walk through the process and understand what health insurance means. In Pennsylvania, they're community organizations that have been helping folks for years. They're the federally qualified health centers, which folks walk into their office every day and they help them enroll in public assistance programs. So we're not reinventing new community organizations, and we need to be assisting these organizations to make sure they have the resources and the tools they need to reach constituents where they are and make sure they take advantage of the Affordable Care Act.
I appreciate that. And you know, the other thing I would point out, you know, New Jersey is another state where the governor, wrongly in my opinion, decided not to set up a state exchange. And the outreach efforts for those states are very limited. The fact of the matter is, if you didn't set up your own state exchange, a lot of the federal dollars that would have gone to help you do that in terms of outreach are just not made available. And so it's particularly important that these community organizations be out there in this very, in this time period, trying to sign people up. And I just, again, I know I'm beating a dead horse here, but I just feel that it was very wrong on the part of the Republicans on this committee to use these kind of tactics right now when we're really trying to sign people up. And these are community-based organizations that really have no axe to grind. They're just trying to help people. So thank you very much. Thank you, Mr. Chairman.
That concludes the questioning. I would like to thank the witnesses for your testimony, for answering all the questions. There may be follow-up questions. We'll ask that you please respond promptly as members submit those. I remind members they have 10 business days to submit questions for the record, and those questions should be submitted by the close of business on Tuesday, September 24th. Very important hearing, very important information. Thank you for your courtesy and patience. Without objection, the subcommittee is adjourned.